So welcome everyone. I'm Stewart Gandolf. I'm pleased to introduce you to our webinar today. This is a super timely topic. This webinar will be recorded. We will have opportunities for asking questions, and so we'll leave time for that. So that's the most common question everybody has. So the recording will be available on our site and also on Freshpaint. The topic we're talking about today is privacy first, unlocking high performance HIPAA compliant marketing. And so this is a very timely topic. I want to switch to the next slide there, Ray, or you're driving? I'm here with Ray Mina, and I'm pleased to have gotten to know Ray in recent months. Our company is been taking this issue very, very seriously. So what I'd like to do is, and again, for those of you who are just signing on, I'm speaking to you in New York from JFK Airport. Getting ready to travel home after speaking. So if there's any noise, I apologize. Ray, can you switch to the next slide and I'll talk a little bit about our company and why we're here, and then I'll turn the ball over to you.
Sure.
So we are Healthcare Success. I know that we've invited a lot of our followers and subscribers and clients, long-term, people that know us pretty well. So we have a fair number of those people on the call. And this is, by the way, a very well-attended webinar today, even more than usual, because it's so timely. We are a full-service, truly integrated agency. So all we do is healthcare. We do work with device and software, but most of our work is with health systems, hospitals, multi-location practices, addiction, really in the provider kind of space. And so what makes us unique is A, that it's all healthcare, B, that we are digital first. So we are absolutely, even though we do branding and creative, we're absolutely digital, and all about results. And so this topic that we're talking about today is near and dear to our heart, and it impacts every single client we speak with, prospective clients as well. So when it comes to compliance, and Ray's going to talk about this more, I just got back from a healthcare investment meeting, right, where they had a lot of attorneys out there talking about HIPAA compliance. And by the way, this topic did not come up at all because they were talking about the more traditional things that happen with HIPAA compliance. So they were talking about record keeping and all the things that matter internally. But on the digital marketing side, there's a lot to be thinking about. So, ADA is something we've talked to our clients about for a while, making sure they have, solutions to ADA compliance, which is not a HIPAA issue. Website privacy policy, you need that, and we recommend terms and conditions. These are sort of an addition to HIPAA. And with HIPAA, that's a pretty broad scope. And again, we're not going to cover everything today, but, obviously you need to have a notice of privacy practices on your site. You need BAAs with the appropriate vendors. We're working through our clients now, making sure we're updating forms and call recording and protocols, scheduling, to make sure that, and this is a moving target. What was okay yesterday is no longer okay. And we're really proactive on this, Ray. We feel like, A, it's the right thing to do, but we also, as we'll talk about in a little bit, want to avoid headaches and nightmares that are unnecessary. But the primary focus today is going to be about a new HIPAA guidance recently issued about digital tracking technologies. And so our firm has invested tens of thousands of dollars talking to our attorneys, and also probably the equal amounts or more of our employee time looking at what are the options, what kinds of things can you do? And there are other options, but with Freshpaint, we're so impressed with, for our needs, it's what we're recommending to most of our clients. And as we developed a relationship with Freshpaint, we thought that doing a joint webinar would be a really good idea. And so today, it's not going to be a big sales pitch, but Ray's going to be walking you through, what the landscape looks like, how we got here, where we're likely to go, and then the Freshpaint solution, what that's involved with. And for those of you that are interested afterwards, and either existing clients of ours or prospective clients that want to talk about Freshpaint, our service, or whatever, we'll solve for that today. But I think you're going to find today a very, very useful webinar. So did I cover that right, Ray? Anything I missed?
Yeah, you nailed all the touch points. Yeah, I think you and I, when we connected after HIC, what we talked about was the thing that I've been really encouraged to see, and we're going to get into this history in a minute of like where did this start and how do we get here. The thing that I've been encouraged to see, and I promise to make this webinar a lot about like how to move forward, is that in the beginning everybody was just talking about what is the guidance, like what is going on. And that shift has started to happen where now people are having conversations about what do we actually do about it? How do we actually move forward and continue to do our jobs and continue to reach consumers? So we're gonna do our best job to make sure we keep it focused on, instead of creating fear for everybody, like what is actually the path forward? How can we have privacy and high performance marketing? Because that's ultimately the new world that we live in. I do think it's worth, because there is still some confusion on like, why should I care? Why should this be something that we do anything about? And I've heard that there's a mixture of people who are already ahead of this. They've already implemented solutions and have figured out how to navigate this. And then there are people who are still not doing anything about it. I think it's worth talking about, like, this has actually been going on for a while. It started back in 2022. A journalist at the Markup basically did a teardown piece on 100 hospital websites, and they outed 30 hospitals for sharing PHI with Meta. And right after that, that literally caused a cascade of class action lawsuits. No regulators had stepped in. This was just lawyers finding former patients, suing Meta, suing some major hospital systems. And it reached such a boiling point, I think, that HHS and OCR felt the need, because I know that a lot of people are frustrated with OCR about this guidance, but their big initiative is to make sure that healthcare systems don't get sued. And so I think they felt the need to actually offer some guidance around web tracking technologies, because when HIPAA was created in 1996, like, Google Analytics tracking and Meta Pixel were not even a thing to consider. And so they felt the need to create an update to make sure we're considering some of these things that are hanging on the website. And that happened in December of last year. That created a massive shift, because before that, of course, everybody was thinking about privacy in a post-auth world, but nobody in traditional healthcare was thinking about things as it relates to anonymous visitor on your website. And that's essentially what the guidance did. That's the shift that it made in mindset. And then right after that, you started to see the FTC getting involved with consumer privacy in healthcare. FTC is not HHS. It is not about HIPAA. It's about consumer privacy and a whole bunch of other regulations. But they issued fines pretty quickly against several healthcare organizations, some of which were not even covered by HIPAA. So GoodRx got fined by FTC. We're not covered by HIPAA, but still were penalized. And actually, the biggest impact there, some of these organizations in the settlement with the FTC, they're banned from using these platforms. They cannot do advertising on Facebook or Google Ads going forward. So for a company like BetterHelp, that's probably a bigger hit than any kind of punitive fine, is not being able to use these tools going forward. Right after that, the FTC went to Congress, asked for additional funding to take on more complex privacy cases in healthcare specifically. And then in July 2023, after the AHA petitioned and said, hey, we think that you've overstepped and this guidance is out of line, the response they got to that letter was a joint letter from FTC and HHS issuing a joint privacy warning to over 130 hospitals and healthcare systems. So if folks were waiting for HHS and FTC to back down off the guidance, that July letter basically said it all, that they were going to like protect consumer privacy. And the leaders in some of these organizations have said on multiple occasions before Congress that they're going to do everything in their power to protect privacy amongst consumers, and especially in healthcare. So a lot of what we talk about is this concern over OCR, but I think what this presents to us is that this is about class action lawsuits. This is about FTC, consumer privacy. This is about HHS. And a few thought leaders at HCIC pointed out to me, this is about consumer trust. Like, if you're a brand in healthcare, having trust from your consumers is a lot more than any regulator or lawsuit. So this is a moment that has been going on for a while, and there's a lot of reasons now to pay attention to privacy in healthcare.
Yeah, I'd like to actually back up on that too, Ray. So the couple things that are really important to keep in mind is that, number one, as Ray mentioned, we were initially comforted with the idea that this is covered entities, which at least takes away some of the clients we work with, right? But then you get the FTC involved. So, cash-based businesses, which have nothing to do with HIPAA, are it's problematic. And the other part of this is that, our company, fortunately, we've never had any HIPAA issues with any of our clients. And the idea, the specter of, from our standpoint, we're just conservative. We'd much rather do, number one, the right thing, but from a defensive measure to, who needs the headache of it, whether it's frivolous or not, of class action lawsuit, right? Or, issues with HIPAA. So this is a super important topic from many different angles. So I'm excited for us to dig in even further.
Yeah, I think the next place to go is just kind of a clarification, because we hear this a lot too. There's a lot of confusion, and there's a lot of different interpretation of what exactly OCR said about HIPAA as it related to web trackers. And I hear a lot about it's not really clear, or this one piece of data is gonna trip us up. There's been some very clear guidance if you read the language, and think of it like a recipe, like a formula. So you need to have multiple pieces before you would be concerned with a HIPAA violation. So let's talk about a web tracker that's hanging on your website. It by default is going to capture several pieces of data. It's going to capture identifiers like device ID, IP address. If there are form fills, it could capture information that's in the form that could be identifiable, like email. All these things that HIPAA calls personal identifiers, what's important about them is that they can be reversed to identify the user. So it's Ray, it's Stewart, it's Sally. But the guidance didn't say the identifier by itself is the problem. That's just the PII part. They're concerned about protected health information, and protected health information in the guidance is the identifier plus some specific health information about that visitor. So let's say if a visitor goes to a page about pregnancy services, or does a find a doctor lookup for orthopedic surgeon, or schedules an appointment, and fills out a form there, that suddenly becomes health information. That's something specific about their journey through your healthcare organization. When you combine that with the personal identifier, now you have protected health information. However, and we're gonna talk a little bit about this today, there are going to be a bunch of tools in your organization that it's going to be okay, and you can make okay, to share protected health information with, just as a signal to what some of those things are, like a CRM tool or an engagement tool to personalize communication with your visitors and patients. That could be okay if you take the right steps. And one of those steps that most people know about is getting a business associate agreement, a BAA, signed by that vendor. It's just legal framework to make it okay for you to share PHI. And OCR is very specific that that is a possibility. Where you run into problem is when you have PHI, when you have these two pieces and you share it downstream with a tool, Google Analytics, Google Ads, that doesn't sign a BAA, that is suddenly the HIPAA violation that OCR has pointed out is their biggest concern. So if you're a marketer on this call and you're having conversations with legal and compliance here, and they're raising the fact that like an identifier by itself is PHI, that's something that you're going to have a more thorough conversation about. It may require bringing in someone from the business side, because if that's true, if that's your interpretation, you're kind of toast. Like every single tool that you install and hang a web tracker on your website, it needs some kind of IP address or some piece of information to make the internet work. So this is an important thing to fully understand, because this will help you have that dialogue, and it will inform how do you actually move forward. Stuart, anything you want to chime in on there?
No, I think the one thing that's really important to recall that I should have said probably earlier is that this is a complex field, right? And we're giving you some best practices business advice, but we're not attorneys. And so you still need to work with your compliance team.
Yeah.
If you have a HIPAA attorney, and this is, by the way, when I'm saying this, I would work with somebody that's their field, is HIPAA. And it's hard enough because this is a subsection of HIPAA. So you want to make sure they really understand this. And we have an attorney that we could refer people to if they're interested in, and there's actually a number of them out there that understand this issue. But it's important. What we're trying to do here is provide solutions that your counsel will get behind and say, this is okay. But at the end of the day, you really need to get legal advice around these issues. So,
Yeah,
but I think
that's right.
go ahead, Ray.
No, you nailed it. Like neither one of us are lawyers here. All we can do is share what the rest of the market is doing and how they're interpreting. But you need to have those conversations internally, and you need to get to a place of synergy between the different stakeholders, your legal compliance team. Everyone needs to get on the same page on how to interpret this stuff so that you can find that pathway forward. But yeah, that's awesome that you have resources that you could point people to as well.
There is one thing relevant too. As soon as this came down, I called one of the, not our personal attorney, but one of the leading law firms out there for advice on this, and it was happening so fast. And he said, "Well, I can't represent you because I'm so busy." He was actually representing some of the health systems under attack, right? One of the big healthcare law firm in Chicago that we speak at. I'll put it that way. But anyway, his guidance was that he was surprised that the OCR came out with this guidance without getting any industry input. And then the big thing I think that may be getting lost here is that, IP addresses were never contemplated, to my knowledge, previously. That was something that was not, and you could still argue that that's not really PII. So this is an industry where, what used to be okay a year ago is now suddenly not okay. And another thing that you'll be talking about, I'm sure, is the Facebook pixel, when this first started to come down, was our focus, but now even Google Analytics, which is the sort of epicenter of all digital marketing, is an issue now. And so that's why, again, these are just important points. So it's surprising how quickly the whole landscape changed. And it's not just us, it's not just our clients, it's like pretty much anybody who has anything to do with healthcare marketing is working now to figure out what the appropriate options are.
That's right. Yeah, that's right. Well, let's get into, you mentioned, Meta, and obviously that was the markup piece back in June of 2022, but it has extended to other tools. Any tool, you can kind of think of it as the entire ad ecosystem. Any tool that's basically requires a web tracker on your site to like feed data to that tool to create reports in Google Analytics, or to optimize around conversions in some direct response advertising platform. That web tracker sits client side, literally loads onto your website when a visitor comes to your page or visits any of the pages on your site. And by default, it's designed to capture a lot of information that inform those downstream tools. And so that tracking technology is exactly what OCR called out. Now, I've read the OCR guidance probably 100 times. And what I found is really interesting is they never called out the actual tool. They never said, like, you can't use Google Analytics. They never said you can't use even Facebook. They specifically called out in every sentence tracking technologies, the web tracking technologies. And so that's where we started to talk to our customers and people in healthcare is how would you deal with something like that? Like what would be the path forward? And so then you have to look at the universe of like, which tracking technologies are the ones that we're most concerned about. And really right now it's like three categories. The ad platforms that I mentioned, it's not just Google Ads, it's Microsoft Ads, TikTok, Twitter. If anyone's still advertising on Twitter, that's gone a little bit sideways these days. Google Analytics or any other analytics platform where there's no BAA in place. And then even video has started to come to the surface, because if you host videos, if you upload them to something like YouTube, and if you've ever done that, you know that YouTube generates a transcript of that video. If that video contains health information, then Google has context about health. And then if you put an embedded player on your healthcare website, we met someone at HCIC who has 1,300 embedded videos to basically improve the experience of their visitors and patients. Every time someone plays a video from your website, their IP address is shared with YouTube. And now you have the context of PHI without a BA in place. So these are the tracking technologies that people are starting to be concerned about. And I don't think that any of them anytime soon are going to sign BAAs, because the ad ecosystem is all about targeting. It's all about getting as much consumer information as possible to fuel these like combined $250 billion a year advertising models. They basically built some of the best advertising businesses in the history of the world, and it relies heavily on a lot of consumer data. So throttling that consumer data is something that they're not really interested in doing. I mentioned about the FTC, right? Like a lot of our conversation today is about HIPAA and about HHS, but the FTC has basically come out and said that they are very interested in protecting consumer privacy, and they've signaled very strongly that in healthcare, our founder and CEO actually met with the chair of the FTC in San Francisco a few weeks ago, and the topic was about privacy, not just in healthcare but across multiple industries. And we got a strong signal that healthcare is really a canary in a coal mine. It's not just a healthcare problem. You're seeing lawsuits with retail pharmacy chains. You're seeing the tax industry getting penalized by the FTC over sharing of sensitive information. So this consumer privacy thing is picking up steam, and it's actually one of the topics in Congress that has a bipartisan approach to it, both sides of the aisle, because American sentiment is concerned about privacy, especially with ad tech technologies. And so you're seeing more and more people supporting better privacy approach for all consumers. So we'll see where this goes outside of healthcare. So let's talk a little bit about like moving forward. Like if this is the new paradigm for us, if consumer privacy is something that we have to be concerned of, you know, the approach of just remove all the trackers and stop using these platforms is probably like a near impossibility in a market that's, you know, driven by consumers. Like you're in healthcare, at the end of the day, you're marketing services to consumers, and it's a good thing. Like those services that you're marketing consumers help people improve their quality of life, maybe even save lives. Like it's important for us to continue to do that. And I think the thing that's really important to call out here is that, look, we're a software vendor. We make software to try to like help you mitigate this, but this isn't a problem that's solved by one product. Like this is a process problem. Like you're going to need to take a new approach to doing marketing within healthcare that has a privacy first lens on it, and that's going to require a process. It's going to require collaboration, as Stewart said, with your legal compliance team and your business owners and maybe your IT team. And then it's going to require like an ongoing approach to this. There's nothing where you're going to be able to do where you just set it, forget it, and walk away. This is something you're going to want to like manage, and you can. And this is kind of the framework that we're seeing a lot of organizations take. And it starts with getting a lay of the land. Which web trackers are even installed on your site today? Like if you don't know that right now, even if you decide to do nothing, that's a great starting point, because once you know what trackers are installed and where they're installed, you can just get a better understanding. Are these trackers sharing PHI? Maybe you don't have any trackers on pages that contain health information, and maybe your legal and compliance team agrees with you that it's okay to do that. Or maybe you do, and those tools, after doing a little bit of research, you either have a BAA already in place, a business associate agreement, or you can just get one, or there's a different tool that you can switch to that can be HIPAA compliant. So those are really the first three steps, is just understanding where the trackers are installed, which ones are sharing PHI, is it okay to share PHI to those tools? And then once you get to, and we're going to talk about this in a minute, most organizations get to a place where they ultimately have like two buckets of tools. Some of the tools where they actually can make them HIPAA compliant and need to, and some of them where they can't, like ads and analytics and things like that. Then you're going to need, what are you going to do about those tools? Like, how are you going to govern the data to something like Facebook to make sure that it never gets PHI, because it can't. And then once you get to that clean slate, you know, if you're working with a great agency partner like Healthcare Success, they can work with you to stay on top of new web trackers, because maybe they're the ones helping to manage your tech stack and do that together. But maybe there's other people in your organization that install a new tracker on your site. You're going to need to monitor that, because you don't want to have any surprises. You don't want to spend all this time getting to a clean slate, and then suddenly, unknowingly, someone has installed 3 new trackers that may be violating HIPAA. So it's really about this audit all the way through to monitoring approach that goes beyond software. It's really about process and teammates that work together. But there's a part of this that, you know, we can help. And the first place you're going to get to that I mentioned is you're going to have you're going to end up with two sets of tools. You're going to have tools where you just cannot get a BAA, and you're going to have to manage the flow of that data. We're going to talk about how that would be possible a little bit today. But again, we've covered these tools. It's the ad platforms, analytics, video. You can't send them PHI. So you're going to need to make sure that you can feed the right data set to them, but not so much data that, you know, runs you afoul of the regulators. The other bucket of tools you're going to have are all these tools where you really need to get a BAA, or you can get a BAA. We have customers come to us that are using HubSpot. I don't mean to call out HubSpot, but this is one we hear a lot. HubSpot is a CRM. We use a CRM to do personalization. Like if you have a visitor that comes and becomes a patient, you're going to have information about who they are, their name, their email address. That's how you communicate. You're going to need an email address to send them a message, or a phone number to send them a text. And if you're any good at marketing, you're going to want to segment those visitors and patients into where they're at in their journey. Like if their journey is follow-up appointment, or if their journey is like a 9-month pregnancy period where you're going to send them reminders about their baby's health and the mother's health, you're going to need to know that health context. So that's PHI. And so there's no way for you to use a tool like HubSpot, which by the way, won't sign a BAA. There's no way for you to use a tool like HubSpot without a BAA. So if you're on HubSpot today, there's no software out there that's going to make HubSpot HIPAA compliant. You're going to have to switch, or you're going to have to get a BAA put in place. Other tools like that are data warehouses, where you want those to be the source of truth that may contain a very rich data set. And then tools like session replay tools, where you have visitor information and a bunch of context. There are tools, there's just no way around it. You're going to have to get a BAA. And that's the first part of the journey. Now, when it comes to the tools where you need to control the flow of data to the ad ecosystem, this is what that starts to look like. So visitors come to your website, or if you have a product or some kind of app experience, and they visit your site, you need some way to safely collect that data. The web trackers that are powered by some of these tools are not going to be safe according to the guidance. So you're going to need some way that is BA supported that will actually, collect that data. And then again, this is where you have the branching of the tools. You can send all that data down to the tools where you have a BA, like your CRM, but then you're going to need this governance layer when it comes to the tools like the analytics and ad platforms. So this is a simplification here, but this is what that new ecosystem starts to look like. And in order to handle the governance part, in order to actually manage the flow of the data, you're going to need some kind of solution, whether it's custom built in-house by an engineering team, or if you don't have an engineering team, like a lot of healthcare marketers, you're going to need a healthcare privacy platform. You're going to need something that can actually help you set this up yourself and help you manage it, along with support from your legal and compliance team on an ongoing basis. And so the first thing that this starts with is you're going to need to remove these native trackers. So if you've got the Metapixel, if you've got Google Analytics, if you've got Google Ads tracking on your website, the longer it's hanging out there, forget about that you're violating the guidance, like it or not. The longer that it's hanging out there, it's like a signpost. It's an invitation for lawyers and regulators to just dig a little bit deeper and see, like, what data are you sharing with those tools. And so Freshpaint as a platform, what we do is we replace all those native trackers with Freshpaint with one tracking snippet, and then we sign a BAA with every single one of our customers. So that makes it okay for Freshpaint to collect that data. So new world is all those trackers are completely gone. If someone does a scan of your site, they will not see the Metapixel, they will not see Google Analytics tracker, they would just see Freshpaint. And if someone asks you questions, you would be able to show that you have a BAA, and it's okay for Freshpaint to collect that data. This is where it gets interesting, because just because we can safely collect the data, as I mentioned, you're going to need some way to govern the flow of it so that PHI doesn't end in the downstream tool, because that's really the problem. If we can collect all this PHI safely, but all we can do is send PHI to Google Analytics, you're in the same boat. And that's where we've learned, working with healthcare customers. We were doing this way before June of 2022. we were working with health tech companies like Talkiatry and Modern Health and Two Chairs, and we were helping build this product because they recognized some of these problems from their own teams internally. And what we learned was, okay, we've collected the data safely, but we need a way to make sure that PHI doesn't accidentally ever get to a tool like Google Analytics. And so what we do is when you connect Freshpaint to, and I'll use Google Analytics, but this applies to all of these ad tools as well. When you connect Freshpaint to Google Analytics, we send no data. So the default state is no data is being shared. That's very different to the native web tracker that you may have installed today, because the default state is they're going to send as much data as possible. So your starting point is, we call it safe by default, because not just PHI, no data is being shared to that tool. And then we give the marketing team a user interface that allows you to choose which data is safe to send to each tool. We're going to talk about the two use cases because they're slightly different. But the point is, you basically have to opt in to say what data is safe. So if it's a tool like Google Analytics, of course, you're going to need page visit information. Of course, you're going to need conversion information. Of course, you're going to need source information and time on page information. But you don't need to send any of the HIPAA identifiers because Google Analytics doesn't need those to operate. So in our context, you would just never opt in to send an IP address. You would never opt in to send a device ID. And therefore, that data would never end up in a tool like Google Analytics, and you would never be sharing PHI. And all of this is done without the need for engineers. So once Freshpaint is set up internally, this can all be controlled through a user interface without engineering custom building things or setting up custom settings or filtering out data for you. So I think it's worth to conceptualize this to make it really crystal clear is just to talk about the two major use cases. So analytics and the ad ecosystem are major use cases for every single healthcare organization we've talked to. So I mentioned on the Google Analytics side, Google Analytics is going to receive a lot of health information about visitors to your site. All those page URLs, the button text, the conversion information, all this stuff is context about their visit, and you should assume at some point along the way, it's going to be health information. And that means like you can never, ever, ever share a HIPAA identifier with Google Analytics. That's how you remove the possibility of sharing PHI. The good news is, and if you're a marketer like me and you've been using Google Analytics for a decade, when you go to your reports and dashboard, you don't see anything about me as the visitor. You don't know it's Ray. You don't know that it's Stewart. You just see that 5 people visited the pregnancy services page and 2 converted. But it's anonymous looking to you. The issue is that Google actually knows, and Google has predictive analytics in their platform that they call out that relies on identifiable information to utilize. So that Google is capturing identifiable information that they're able to leverage inside of their server farms. They're just not displaying it to you in Google Analytics. So the implementation here is we just never send any of the HIPAA identifiers to Google Analytics, and therefore we're never sharing PHI. This does create one problem. And that problem is Google Analytics, I don't care about Google Analytics as a session-based tool. I want to see the entire visitor journey, right? Because as a consumer, I may make multiple visits to your healthcare brand's website before I schedule an appointment. And you want to see that track. You want to see how I experienced. You want to see how you can replicate that success. And in order to do that, usually Google Analytics relies on something like a device ID to stitch together those sessions. And so because we can no longer share the device ID or the IP address, Freshpaint out of the box replaces it with an anonymous ID. The anonymous ID allows Google Analytics to recognize that it's the same visitor across all the sessions, but they can never reverse to understand who the visitor was. So they cannot personally identify that it was Ray or Stewart. This is how we solve for making sure that we can make this a journey tool, a visitor journey tool, without ever sharing any identifiers with Google Analytics. This all happens out of the box. When you connect to Google Analytics and Freshpaint, we just do all this for you so that there's no need to build some kind of like custom scheme to pull this off. Now, the other use case is ad platforms. And a lot of people, one of the problems that you have when you start to remove some of the tracking technology is you just lose the ability to report off of conversions. I would argue that that is probably the least of your problems when it comes to modern day ad platforms, in that when you remove the data, if you're running any kind of conversion optimized bidding strategies where you're letting the platform basically do the bidding to maximize scheduled appointments or new members, you've completely cut off that data loop that facilitates that. What I mean by that is the way, if you're like me and you started in the manual bidding days where you like bid cost per click, those days are long gone. Google ads, Facebook ads, they all work in a way that if you feed conversion data to their platforms in the background, they can automatically target from their huge data trove of consumers. They can automatically target to try to serve you more people that were likely to convert. And the way that works is you just feed, say, Facebook, say 50 to 100 initial scheduled appointment conversions, and Facebook builds a match list and an audience behind the scenes. It just happens automatically. And the goal is to send you more scheduled appointments at a certain KPI. Maybe there's a cost per lead that you're trying to anchor on. There's a whole bunch of ways in that platform that Facebook and Google Ads can facilitate that. If you cut off the data feedback loop, impossible. You can't do this without data. But the problem is, like the Metapixel and Google Ads tracking, it's sending too much information. It's sending PHI, and that's exactly what the regulators are telling you not to do. So the good news is that Facebook and Google and all these direct response ad platforms, they actually don't need that much data to make that feedback loop work. We've tested this with a whole bunch of our customers, and there are two required data points. You obviously need to tell the ad platform that a conversion happened. Like if your goal is scheduled appointment, don't share that it was scheduled appointment, because that could be health information. Just share a generic lead event. So a lead, or call it some random name that is not identifiable. And then they do need to know the ad click ID. So the ad click ID originates in Facebook or Google Ads when someone clicks on the ad. And it does contain attribution information about which ad was clicked or which campaign, but it does contain some identifiers that can let Facebook or Google know who that actual person was that converted. With those two data points, there's no health information there. So you remember our formula, PHI is identifier. There's definitely an identifier here, and health information. There's no health information because we're not sending any page visit information. We're not sending any context about that journey through your website. And these two data points are enough to allow those ad platforms to automate your bidding in the background to serve you better conversions. Now, if you add more identifiers, never health information, match rates can get better and can be even more effective. But that's a conversation you'll have to have with your legal and compliance team to see what they're comfortable. So analytics is you can never share identifiers. Ad platforms, you can never share any health information or health context about that visit. So I'll stop there. That was basically a walkthrough of like, how did we get here and what's the path forward? And I want to make sure we save some time to go over questions and answer questions that folks have. Before I do that, though, I want to offer, because this is very nuanced, and there's a lot of like detailed questions that people often have. I wanted to launch a poll to put the offer out there that if you did want to reach out to follow up with either Healthcare Success or Freshpaint or both, feel free to do that, and someone from our team can follow up with you to answer questions specifically. So we just launched that poll. Feel free to reach out to connect to us right now. I'll stop sharing, Stewart, and I think we have a couple questions that have come in already. So yeah, so the first question that we had is, we don't have any tracking tools in place since the new guidelines have been. So this is someone who's basically received the guidance and has removed all the tracking technologies from their website. And they're asking, what if we just keep running Facebook and Google ads without that data feedback loop. And I talked a little bit about this at the end, but I wanted to see if you're an expert in marketing. You have a team of 50 people who do this all the time. What's your thought there? Like, if someone wanted to spend a bunch of money with you but didn't want to track any kind of conversions or things like that, what would your recommendation be?
So I'm a metaphor guy, Ray, as you probably already remember.
Yeah,
So I'm imagining somebody blindfolded shooting a machine gun just kind of at wherever. And that's really the problem, is that you can do it. And we do have some clients that have just said, we're just taking the pixel off. And so that is an option, for Google Analytics and Facebook. Facebook was a little easier because we just did something different. But the challenge is you can't judge your effectiveness of the marketing, number one. Number two, you can't optimize, because, as a reminder, if you're optimizing off of, that's the magic of all this, is that when our team is working on whichever platform, we're always analyzing, but optimizing with machine intelligence and with human intelligence to what's working, right? So if you're not tracking, you don't know what's converting. So if you're running, a 10,000, 100,000 or whatever a month paid search campaign, you don't know what's working, what's not. You're just spending money. And that's where the analogy of just shooting a gun up into the air came from, because you really need to get that feedback. Otherwise, you have no idea what you're hitting. And so that's, at the end of the day, what's so important. And another thing that's an insight that you know I've discussed, like for clients that are doing, very little marketing, it's not as big of an issue. It's like still you're driving and walking around blind in an alley. But if you're doing substantial marketing, your marketing won't be effective, and it's just not sustainable. Like, things don't work right.
Yeah, so true. We have some firsthand data points here of organizations who we've worked with who remove trackers and are running substantial ad campaigns without them. We've since restored some of this stuff. And look, this stuff is very black box inside of like these ad platforms, so no one can predict what's going to happen case by case. But we've seen customer acquisition costs go up by 3 to 10x. So, like, I guess if you're a marketer,
so not surprising to me, because it's exactly what we described. That's so not surprising, and it makes it no longer profitable, right? So often.
That's right. Yeah, like a CAC increase of, I know for myself at Freshpaint, I'm not marketing to consumers, but if my CAC went up by 3x overnight, I'm done. Like, I can't continue to like do marketing the way I do it today. It's not sustainable. Someone did ask a question about with Freshpaint, and I didn't cover this today, but I didn't want to get too far in the weeds. I wanted to make it high level, but they asked about if Freshpaint could work with Google Tag Manager. So again, this is one that you'll have to align with your legal and compliance team, but let me just share with you where a lot of folks are falling right now. The way that Google Tag Manager works is that the Google Tag Manager sends the data wherever you point it to. So if you point the data to Google Analytics, or you point the data to Facebook ads, that's where the data is going. It doesn't by default send, there's not like a backdoor to like Google server farms. And so we've been able to make Google Tag Manager and Freshpaint work together, because we created a migration tool that redirects those existing Google tags and points them to Freshpaint first. So they can't continue to point directly to those tools where you don't have a BAA. They have to go to Freshpaint first. And if you remember that way I explained it, is then we run our governance layer and we make sure no PHI goes down. The benefit here is, and Dave on my team always says, we try to do the least amount of harm. By that, we mean make it very easy for you to take your existing tech stack, make it HIPAA compliant and privacy first, but keep operating the way that you do today. The advantage of just taking existing Google Tag Manager and redirecting to Freshpaint is that implementation can be like a week to a few weeks. So you don't have to go and build a whole new event structure. You don't have to like rip and replace all these tools. If your team decides that they do not want to use Google Tag Manager, then Freshpaint does have its own event management system that we can basically set up in our platform and get you off of Google Tag Manager. But we believe that Google Tag Manager, and many teams feel this way as well, that as long as you redirect those tags to Freshpaint first, that it's completely safe to continue to use. This one, I definitely want you to, I have my own feeling here, Stewart, but you've been in this business for a long time. So I want you to weigh in here. Everyone has been following this. So AHA, I think it was like 40,000 healthcare professionals. They sent a letter to OCR asking them to like change the guidance. And I mentioned that the answer to that was a joint letter from HHS and FTC issuing an ultimatum to 130 hospital systems. I took that as we're not going to change the guidance. And then the AHA just recently, I think it was just 2 weeks ago, they're basically suing the government for overstepping with this guidance. And the question that came up is like, what's going to happen from that? How likely is that lawsuit going to impact these HIPAA laws and this enforcement that we've talked about? Stewart, what do you think? Like, what's your feeling?
You know, it's funny. This topic actually came up at Shishmit, and the head of marketing for a major health system was talking about when we didn't really talk much on this meeting about risk management. And so, in other words, in this particular case, this health system was saying the head of marketing, chief marketing officer, couldn't get anybody in his system to pay attention to this. So they said, well, we have risk all over the place. And this is like number 7 out of like 10. And so they were talking about this idea of the hospitals banding together and litigating against that. And I get it. And I think, honestly, as much as I love you guys, that would be awesome if we were able to make this all go away. But I don't think it's going to happen anytime soon if it does. And so for me, I mentioned at the beginning of this thing, I'm a conservative guy. Like, I have enough problems in my life without worrying about frivolous lawsuits and OCR problems. And most of the clients we talk to are like, Stuart, we just need to run our business. That's why we hired you, right? Even the most sophisticated clients we work with are like, that's why we need help. We can't do this stuff. So to take this all on, because there are other tools. I mentioned we've looked at about 30 probably other tools or other options of ways of trying to solve this. And we landed on Freshpaint just because we thought for most of our clients, almost really all of them, it's just a more practical solution. And I look at this as an insurance policy because, in my opinion, if you were to ask me, right, I was like, will this get resolved or not? I don't think the world will ever go back to where it was. That seems highly unlikely. And even if it does improve, it's going to take time. And so I look at this as an insurance policy, honestly. And we have a lot of things we have to spend money on that I don't like to spend money on, right? So it's like, but that's just the reality. It's like, this wasn't contemplated. So I totally get the frustration from, the hospitals and the practices and the telehealth companies and all the various people we work with. Of like, oh my gosh, just one more expense. But the flip side of the downside of this is worse. So yeah, we'll see how it plays out. I do not have a crystal ball as much as I study this stuff, but I'm looking at it as, okay, well, what am I going to do for the next 12 months? Do I want to, risk go, in a metaphorical way, run naked, or do I want to be protected? Right. That's kind of my viewpoint. I'm curious what you think, right?
Yeah, I think like you, I'm not a lobbyist. I'm not a lawyer, so I can't predict. But one is there's a lot of precedent here where organizations this is part of how things work. Like an organization like the AHA will sue to try to like change something. Very normal pattern. Those things, and you can Google search a bunch of things the AHA sued the government over. This isn't 12 months. These are like 3+ year of court battles for sure, especially around something that the FTC and HHS have already said they're gonna dig their heels in about. So this is years worth of litigation, and so that's the first question is like, do you want to run with trackers on your website for the next 3 years and roll the dice, or do you want to remove this stuff for the next 3 years and see KPIs deteriorate? The other part that the part that bugged me a little bit was that in the AHA's lawsuit, they were very specific about saying that healthcare cannot continue. Like, it's a burden on healthcare to not be allowed to use these trackers. And I think that's a little bit of a one-sided argument because we already know where consumer sentiment lies as it relates to ad tech. Like, AHA is essentially defending ad tech, which most consumers would not want to hear. And healthcare professionals, I believe, like, my perception of those brands are some of the most trusted brands in the world. Like, I trust my healthcare provider brands like UCSF way more than I trust like Apple or some other, consumer brand. And so I feel like the right question to ask is, how do we move forward? How do we actually protect consumer privacy and have these outcomes from our business standpoint. And that to me was completely missing from the lawsuit. And you've done the research. It's not just about Freshpaint. There are 30 ways that you could do both. There are a bunch of ways to solve this. So it's not like one of those scenarios that there's not a path forward.
Right. Well, I was just going back to that comment. There's lots of ways of doing it. It's just a question of what's practical.
Yeah.
And the other part of this is in terms of, again, I'm not as close to the lawsuits as you are, because obviously that's your business focus, but we definitely study this a lot. But it's like the question of whether it's an overreach from the government is a separate question, but it will take forever to be resolved, in my opinion. And the second thing is, like forget, a lot of people may feel like we're under the radar, and we are, again, I'm just conservative. I want to protect our clients. So clients at any level, we want to overprotect and, keep out of the fray of, so somebody may see that they feel like, well, I'm not that big of a fish, but that's, sometimes that's who the class action lawyers like, or the government. And again, you have two different issues. It's not just the government and now different agencies of the government. Now you have class action lawsuits, or just frivolous lawsuits on a one-off basis. Like we had a frivolous lawsuit against us over using QR codes once. It's a frivolous lawsuit.
Yeah.
My attorney said it's going to cost me 100,000 to defend, and we did it a different way and resolved it. But like that's just a nasty, horrible thing. And frivolous lawsuits, it may not even, if you win, it's still a distraction to your business. So that's the thing. So I just believe in trying to, I look at it as an insurance policy. I really do. It's like I may not like it, but I just hate on the flip of it. It's like it is a risk mitigation question. Like, well, how likely is it, and how much could it be? I'm just a conservative guy. I have bigger problems to worry about in my life than unnecessary stupid risk.
Yeah. I think we have time for a couple more questions. One, this was actually a good question because I want to like point to a potential future here, which is, are we losing, like, will we be losing any information? Like if we're using something like Freshpaint to collect the data and then govern it, would it be losing or gaining information? And what we see is that because Freshpaint will sign a BAA, we can collect the entire first party data set, like what's happening on your website, what are visitors doing. So in that context, you won't be losing anything. And then when you have downstream tools where you also have a VA, like a data warehouse that you want to do like very detailed analysis, or a CRM tool where you want to do very personalized and segmented journeys, it will facilitate that. What we've started to see, which we didn't expect, everyone agreed before this guidance that you would never put like analytics tracking in a post-auth world. Like no one was doing that. And a lot of these platforms have moved towards like really great post-authorization experiences, but they're flying blind. Like if you're a hospital that delivers babies, where does the real conversion happen? Does it happen like when the person like becomes a patient, or does it happen when they deliver the baby? And some organizations are interested in like measuring that. You can't do that with Google Analytics, and you've never been able to do that. But because Freshpaint replaces all those non-compliant trackers with one that's powered by a BAA, we can actually start to help organizations get a better view and get more precise measurements over what CAC really looks like, or what KPIs really look like. So we're actually seeing cases where people are starting to see gains, that moving beyond just this acute privacy problem, they're actually starting to get the tooling in place that they haven't had before, that helps them, power better experiences and improve lifetime value. And obviously, the holy grail of healthcare marketing is improving margins, because it's notoriously low margin industry. So we haven't seen loss. We've seen actually people like find a better way. There's also something that people, this one is a little bit complex, which is, if you think about like the content that you create, like, and specifically for advertising or engagement, like there's a question of how personalized can this content become versus like keeping it generic and brand oriented. I think in platforms where you have a business associate agreement, so if this is like an engagement question and you have a BAA, I don't see anything wrong with personalizing that data, because you wouldn't be violating HIPAA in that context. I think where it gets really tricky is in scenarios like retargeting. Because if you think about the way retargeting works, retargeting requires you to send ad platforms an audience. So like maybe people who visited a pregnancy services page, you want to retarget them to like, provide additional support and information. So you know where that audience came from. Even if you share that audience with ad platforms in a way, and Freshpaint can facilitate this in some of these platforms, you can send that audience to the platform in a way that doesn't reveal anything about the health context. Like they don't know what pages they visited. They don't know anything about their journey. The next part you have to think about is if you then serve an ad that is about pregnancy services, or it's very specific to where they're at in their health journey, because you introduce the audience to the ad platform, you may be introducing the element of PHI. So in that context, and again, this is a conversation to have with legal and compliance to talk through how this works, but you may be better from a marketing standpoint of using more brand-driven content versus like treatment or condition specific content to keep yourself safe. But that's how I would think about it, is like, where are you introducing health information and the audience? Are you doing both? Or are you just introducing like an audience without health information? That's where you have to like start to like have these more detailed conversations. We've seen organizations feel very good about direct response advertising, where the ad platform is building the audience, where you haven't supplied it at all, on running more detailed creative. But when it comes to retargeting, we've seen a lot of sensitivity of what type of creative you're allowed to use, because you're the one sharing the audience. And even if you don't tell it that it came from a pregnancy services page, wouldn't the ad itself tell Facebook that everybody in this audience may be interested in pregnancy services? So that's something to think about. It gets a little bit complex and definitely requires that conversation with your legal team. Stewart, I know we're almost up against time, and all these kind of folks that have joined probably have a lot more to do today. What recommendation would you make? Like, how should they follow up with healthcare success if people want to learn more about how you can help?
Yeah, I noticed also there's still ongoing questions, more than we have time to chat here. So I would suggest for those of you that are, kind of in this process, like for our clients that are watching, this is something that is serious. We're taking steps. When I mentioned, I've done tons of due diligence prior to today. So whether we've talked to you about this yet, as we're in the process of rolling this out through all of our clients, it's something that's serious. I don't think it's like, it shouldn't be panic, but it's something I would say start taking action on. And that's the first step, is the first step, right? The first step of a 1,000-mile journey is the hardest. So, like on these kinds of issues, and this, by the way, as I mentioned at the very opening, this is just one of the issues we're working with through, the digital tracking. There's other things that are sort of related or in that ilk. So we're working through our clients, like, and every client has different issues. So in your case, this is applicable, this is applicable, this is applicable. And when we think through about like what to do, I would suggest, take advantage of, we're happy to meet with you. Freshpaint is as well. Reach out to us, and we can explore this a little further. We cannot answer every possible question in this forum. We're happy to follow up, and I think your team can send some questions back to some of the people we weren't able to get to in the chat today. But I really think this is a serious
I don't know how to
issue.
respond to that.
I'm getting serious talking now. That's great. That's a first. I haven't had that before. I saw the little Siri thing going, but I would just say, take the first step. It's a serious issue. It's important. It is what I think. The other thing is that there are solutions, which is important. We're not just coming to you with a problem. We're coming to you with some solutions and ways of working through this. But at the end of the day, it'll require, informed discussions with your team, your executive team, your legal team, and maybe your tech team to some degree, to sort through this. But knowledge is power.
Well, thanks for doing this together, Stewart, and for everyone who attended today. Really appreciate you dedicating some time to learn more, and looking forward to seeing you soon, Stewart. Everyone, have a great day.
Yeah. Thanks.
Take care.
Bye-bye.